Welcome, Archie.
Thank you so much.
How are you doing?
I'm very well, thank you.
The last time I saw you was in London.
Yes, Women of Valor.
Yes. And listen, when we got to London, it was a lot of work. We went for work. And although it was a woman empowerment thing, we also gave, I think Nanaba gave the chance for vendors, small-scale businesses to also come and show what they're made of, but mostly made in Ghana products.
Yes.
So I was going around speaking to people on the stands, finding out what they were selling. And then I came across Archie. And then I saw his product. I was very intrigued. So I decided to speak to him and his wife. At the time, I met his wife. She's not here today.
No, she isn't.
Yes, but I was able to meet his wife. And I think I got a little glimpse of what the story was. Yes. And it's a great one. Once again, if you are at home, this topic is a very big one because it's been proven that women in this world, or black women, suffer a lot of hormonal imbalances. A lot of black women also are the ones who go through fibroids a lot. And all of these things is because we don't do a lot of research to know them. Well, that is why we have Archie, who has decided to break the odds. Because he cared about his wife so much, he decided to break that, do his research, and he's here today. So once again, you are welcome.
Thank you so much.
If you have any questions, please do send it to our number 055-157-5757. Now, actually, we come back to you. Stella was born out of circumstance. Before you went to do your research, I mean, you had been told a number of things. I wasn't there.
Yes.
So please take me through the story so people at home understand what we're trying to say.
So first of all, I'd like to also introduce myself. My name is Archie. I'm a father of two, and I'm a husband to a beautiful woman called Dorcas. I like that. Our journey began when we were dating, boyfriend, girlfriend, and she told me she cannot conceive. I was surprised, because who would want to date someone and want to be married them and you are told you cannot conceive? But you know, Ghana men are very loyal. I stood by her. Thank you. So I stood by her. We went through it. I remember at that time, she had PCOS, she had fibroids, she had 5 fibroids, she had irregular cycles, bloating issues, severe constipation, insomnia, weight fluctuations. She was put on all kinds of medications, tranexamic acid, steroids, contraceptive pills, all kinds of painkillers. Nothing ever worked. So what we did was, I always like to ask the question, why? Why are you wearing this? I heard you mention your designer. So if we go to the designer, we'll be able to know why this was made. Right. So same, we asked, why is the cycle irregular?
Please hold that thought for me. Now we have Doctor who is here, because I said we're not having this conversation again. Dr. Paddy is finally here. He's a gynecologist. So please, once again, put your hands together as Dr. Paddy joins. Do it louder.
Welcome.
Hi, Doc. It's good to see you.
Indeed. Good afternoon.
Good afternoon. Trust you're doing well.
Yes, I am.
You look fly, very dapper. I can see that you prepared for us. Please put your hands together once again for the surprise. Right. So, Doctor, we had already started the conversation. I would like him to pick it up so we can come back to you. So, at the time, where we left off.
So my wife was put on contraceptive pills, tranexamic acid, steroids, all kinds of painkillers. Nothing ever worked.
Okay. So when you found out during boyfriend and girlfriend,
yes,
at what point did she get that information?
She was told around those times. She used to do a lot of tests. So she knew she had PCOS. Later, fibroids came into the picture because she kept feeling abdominal pains. Whenever she called the GP, she was given painkillers. She wasn't even seen in person sometimes. She was given painkillers for about a year until there was a much more severe pain. Around that time, we were even in Ghana. I remember we went to a doctor friend at Sotium, Dr. Kisi. So in conversation, he realized, okay, you're taking tranexamic acid. Why? So that's where the PCOS conversation came up and the fibroid and all of those things came up. So he even said, then stop taking the tranexamic acid. Here we are, there's a lady from the UK who has been prescribed tranexamic acid. And that got me wondering, 2 doctors, one in the UK, one in Ghana, why is the other one saying don't take? Why is the one in the UK saying take it? And that led to me reading around it, reading what the tranexamic acid is for, the contraceptive pill is for, and why my wife was developing 1 new fibroid every year. So that's where the journey began from.
Right. At what point did you realize that there were a lot of imbalances? Because at the time, before research, we take you back into visiting the doctors all the time. At what point specifically did you see that, okay, this is a problem that is not getting solved?
I never even knew what hormonal imbalance was. I had no clue about it. And growing up, I always had my younger sister always going through painful period, very severe painful period. She would be in bed for days. My mom would give her painkillers. Even when she went to the hospital or pharmacy, she was given painkillers upon painkillers. So to me, it was normal. It was normal to see a woman go through pain. That's how I understood it. Until I got married 1st of May 2021, and I saw my wife was going through, that's when I realized this is not normal. So I relocated from Ghana to the UK. We continued the research. Whatever I was reading, she was trying. So after a few weeks of being in the UK, she was pregnant. And there's someone who has been told you cannot conceive.
Right.
And here we are, she being pregnant. I remember the very first scan we did, an 8 or 9 week scan. The guy telling us from the screen, this fetus will not survive because of this fibroid beside it.
Right.
That same fetus they said wouldn't survive is our 3-year-old daughter. She'll be 4 in 2 days' time.
Wow.
So she survived. She survived. Like, it was a very difficult pregnancy. From 20 weeks onwards, 20 weeks is when you know the gender. We got to know the gender. My wife was always bleeding. We had to call the ambulance 4 or 5 times every week. It was a very terrible one. And the ambulance comes, we go to the hospital, we come back until 25 weeks, where there was a very major bleeding, and the doctors wanted to even take baby out. We said no. It was now 28 weeks. Another major bleeding happened. They wanted to take baby out. We said no until we got to 33 weeks, where a very severe bleeding happened. We couldn't do anything about it. We had to rush my wife in for an emergency CS. So we had our daughter at 33 weeks, 5 days.
Right.
And she's very fine. But being in the theater that day, seeing everything go on, as a man who had never been to the theater or labor ward or anywhere before, it changed my perception about women.
Right.
It makes you understand what a woman brings to the table. That's her life.
Right.
Because here's someone's daughter. I had not even called her parents. What if she had died?
Right.
What would I have told her parents?
Right.
But we went through it, and coming out of the theater, I now intensified research, and we had to get to the root cause of it. And that's where we came to what we call hormonal imbalance. And we knew her hormones were imbalanced. Her body was estrogen dominant. Her cycle was irregular and all messed up. We did our research, and here we are today.
Right, here we are today, Dr. Ayete. Let me get into the technicalities of it. In a span of 5 minutes, we've said hormonal imbalance more than 5 times. And a lot of people hear about it. But what really is hormonal imbalance?
A lot of times, it depends on who is talking,
right,
and what they are talking about.
Right.
In this case, we assume you are talking about a woman, and we assume you are talking about a hormone that is related to her fertility. For some women, the hormones don't operate the way they should. So on a normal cycle, you have FSH goes up, estrogen follows. These are hormone-related things. FSH goes up, estrogen follows, estrogen comes down, progesterone comes up, estrogen comes down, progesterone comes down, you have a menses. That is like what normal pattern should be.
Right.
But there are other things that can affect this pattern. And one of the biggest ones is insulin. Now, if your insulin behavior is not appropriate, it causes the other hormones to misbehave. And there are other hormones too that can have that kind of effect. Another one is a stress hormone. So if the stress hormones are high, that happens. Same thing happens. That is why young ladies in school, if you're going to write exams, some of them, their menses doesn't come. Or if they are training very hard for an athletic competition,
right,
the menses doesn't come.
Right.
It's because of other hormones that are raised due to the exercise or the stress that causes this not to behave. Now we also discovered that even inflammatory processes in your body can cause that. So I have a patient that has got very bad ulcer. And when we checked, she's got very high inflammation and she's got her hormones being imbalanced. Meanwhile, the typical things that you would suspect are normal. Then it gets to this point and it is there.
Right.
So there are various things that can influence it. Unfortunately, this is a subject area that is not as well known. I was going to ask. Even in the medical field.
Right.
Years ago, when I started using insulin stabilizers, and I'd prescribe it, they would go to the pharmacy and they'll ask you, are you diabetic? The pharmacist will ask, are you diabetic? You say no. They say, we won't give you the medicine.
Wow.
Right.
And I'm like, yeah, you don't know what I'm trying to treat. Why are you, call me and ask me, oh, doctor, you've written a prescription for a typical anti-diabetic patient who is not diabetes. Can you please explain why? Then I'll explain. And when I explain, you're like, oh, okay, I didn't know that. We move on. But no, some of them will just outright not give you medication. Right. But we've had more education. When I was in med school, this was not discussed. When you ask people why people don't get pregnant, the number one reason was supposed to be blocked tubes in Africa. Well, as a matter of fact, it is between women not ovulating and poor sperm.
Right.
I don't see blocked tubes that often in my practice. It is ovulation issues or poor sperm. And one day we'll talk about the sperm. The sperm are in trouble.
I would love us to come. You would have to come back again so we can have that conversation. Yeah. But I was going to ask, why is it that it's very difficult if now there's education or there's awareness as opposed to the past? Why is it that it's still very difficult to diagnose? Because a lot of women, mind you, live in that parts of the world and don't know that they have hormonal imbalance.
Not only in our part of the world.
Right.
Not only. I was listening to his narrative. It wasn't here.
Mm-hmm. Yeah.
And he was going and coming.
Yes.
I'm here. And then you get phone calls from the UK and the US. This is my problem. This is your doctor said, can I come to Ghana for treatment? And I'm like, oh yeah, come. Then they would come. Then you saw them out. Then they would go back. Mm-hmm. But it is, if you know, you know. But if you don't know, unfortunately, you don't know. And my teacher taught us something. You cannot give what you don't have.
Right.
And it's a specialty area, let's put it that way. So it's not everybody who is well versed in that space. So people come, and there are varieties of even what we think. I was talking about PCOS. Even in PCOS, there are different types. So the origins are different. There are a variety of medications that we can give. So if you have PCOS and we give you 1, 2, 3 medicines, the next person who has PCOS may need a totally different combination. So if you think, oh, this is the medicine they gave to my friend to meet, I'm going to get the same thing. Sorry, you may be in trouble. I
was going to ask the different types of the hormonal issues affecting women today. You've just said PCOS as well.
PCOS is one of which there are 3 different divisions.
Right.
Thyroid issues.
Can we break them down?
No,
so what is PCOS?
Okay. Yes. PCOS is polycystic ovarian syndrome.
Right.
Why do we call it a syndrome? It's because it is not one symptom that we would get or one condition that we would get. It comes from different areas.
Yeah.
Irregular menstruation. When we do a scan, your ovaries appear polycystic, and that is why the name PCOS came about.
Right.
And then some people have got excess male hormones or manifestations of excess male hormones. Now, some people have the male hormones and the ultrasound picture of polycystic ovaries, but their menses is regular. Some people have irregular menses and they have got abnormal hair distribution or male hormones, but when you do the scan, it is normal. They are all part of the same family, but they are different categories inside. And it's one of the the commonest disease that you can find amongst women all over the world. So that is just one aspect. Then there are those who come with thyroid dysfunctions. So you can have either excess, the thyroid hormones are thyroid stimulating hormone T3 and T4. You may have excess T3, excess T4. You may have low levels of T3, low levels of T4. You may have high TSH. All of these affect other hormones in your system. So somebody who has got excess T3, T4, they tend to be more hyper.
Yes.
And there are those who have got very low levels who tend to be very slow in their activities. But it affects your menses, it affects fertility. We've got people who have got high prolactin levels. Prolactin is a hormone that causes breast milk to flow. And when you have a baby, that hormone goes up so that you can produce more breast milk and feed that baby. When that hormone goes up, it tells the ovary that, hey, we are breastfeeding a newborn child. Don't release eggs for a new baby to come to cross this one. This one needs all the attention. But some people are not pregnant. They haven't had a baby. They are not breastfeeding, but their levels are high. And I've seen quite a number today. So once it is high, the message to the ovary is still the same. I am high, you stop. So the ovary does not release eggs. So she doesn't have her periods, she doesn't ovulate, and that, they have excess, they gain weight very easily. So that's another, a pathway. And there are various variations of this. So you can be walking about thinking that, as for me, dear, I can't lose weight like other people. Or you'll be walking about and you notice that you've got milk coming from your breast, but your menses does not come. But you don't realize the relationship between one to another. And because we don't go for annual checkups for them to say, hey, you've come for annual checkup, is this okay? Is this okay? Is this okay? Do you have any things you want to discuss? Oh, I've noticed the fact that my menses has become a bit abnormal. And then we discuss it further. Oh, there's a problem that is coming.
Yeah.
In addition to all this, for people who have PCOS in particular, they tend to be at risk of becoming diabetic in future. And therefore, if you think it is just irregular menses, but that irregular menses is due to PCOS, and that PCOS is due to insulin resistance, and that insulin resistance means you run out of insulin before you are 45 or 50, you will become diabetic in your older ages. Yeah. Because you are burning at a rate, we should be burning your insulin at the rate of maybe 15. When we check the labs, you should be doing around 15. Occasional peak, but you are maybe floating around 15. And then you are doing 150. And I've seen some very high insulin levels. It will finish because the pancreas can only produce a certain amount over that duration. You must be spending 15 cedis a day for the next 100 years. You are spending 150 cedis a day. What do you think will happen? It will finish.
Yeah. This really, once again, I like that we've understood that it's not only in our parts of the world. In fact, women everywhere are going through this and do not know that. I have so much to ask you, but let me come to Archie. You were on ground. We're looking at the human aspect of it. You having to live with a woman who has gone through the dilemma of being told you cannot have children. When she does, she's having to bleed and go to the hospital, ambulances 3 times a week or 4, depending on how severe it was. As a man seeing or looking from the inside, at the time, how was home?
That's a very good question, and it also comes back to how we are raised as men. Because growing up, you are raised as a man. All you know is okay. You grow up, you just provide, but you're not in the home, taking care of the home. A woman is only told, okay, yours is to cook, to clean, to wash. So there's some sort of big difference between a man and a woman. It was until I married that I really got to see what a woman goes through firsthand. And it surprises me that we don't even know a woman's cycle as we are going through school. It's very disappointing. And all the time we have to take our customers through how their cycle is. And like Doctor mentioned, progesterone, estrogen. A woman's cycle, or a woman's sex hormones come from cholesterol. From cholesterol, we have what doctor will call pregnenolone. From that, we have progesterone, and progesterone serves as a precursor for estrogen, testosterone, and adrenal hormones. Let's look at a woman's cycle. So the average cycle is 28 days. What I did was at the start of a woman's cycle, estrogen is low, progesterone is low. By day 7, estrogen begins to rise, but progesterone is low. By day 13, 14, estrogen is at the highest. What is estrogen doing in your body? It's responsible for cell proliferation, massive cell growth, so an egg is forming, your uterine line and all of that is coming up. At day 14, estrogen is supposed to fall, progesterone comes to take over. By day 26, if there's no pregnancy, both hormones are dropping, and the cycle begins again. But how many women are having this particular cycle? And that was what really pushed me to really understand my wife's body well and look more into it and find out why is the estrogen high and progesterone is low. And that's what led us to where we got to.
Right, at the time, that's why I'm asking again, before all your research and how much you know, I'm just speaking from a man's perspective, because men tend to tire sometimes when they don't understand that, oh, this is what the woman's body is going through. So as a novice, somebody who didn't know anything at the time about it, what did that world look like to you?
It was a very interesting time because I was confused. But I always like to ask questions. And I'm sure Doctor and his co-science people learned in school, to every reaction there's an equal and opposite action. So that was what pushed me to look more into it and ask questions. Okay, why is she having abdominal pains? Why is her tummy bloated? Why is her weight fluctuating? Today she's like this, tomorrow. And why was she even doing waxing twice a week? Because, Doctor talked about hair. She had excess hair on the chin, legs, hands, chest. Why was all of that happening? It wasn't normal. And when a woman tends to have more of a male hormone, she starts to exhibit male features, and vice versa. So these were things that really triggered me, even though I had no clue about it.
So that's what triggered you. Let me come back to you now. So he has said that there are certain things. You've already said fluctuation, your body weight. in homes, you'd hear, even as mothers say it, 1 minute you're extremely happy, the mood swings. Is it a big factor? Because we hear that all the time. Your mother was probably happy 20 minutes ago. The next minute she's screaming everywhere. The next minute she's crying, and you're wondering what exactly is happening. Is that a big factor?
The operative word is your mother.
Mommy, I'm not coming for you.
Because at that age, it's a different set of problems.
Right.
That is where what we call menopause sets in. Now, once you get into that, the average age of menopause in Ghana is about 48 years. Once you get into that zone, your normal hormones that you've been used to almost all your life, they come down. And then you start becoming a stranger to yourself. The reaction that you see is, the action you see is a reaction to how they are feeling within themselves.
Right.
And for some women, it is mild. They just notice a slight reduction in their, they just generate the way they are. For some women, however, it's a very acute problem. Today, I heard about a woman who went into menopause after surgery, and it was a very, acute. We don't like that type. But the gentle type, it varies. Some people need hormonal support. Some others don't need hormonal support. But emotional ability and easy irritability and hot flashes are quite common around that.
Right.
And it's up to us now to be very understanding if you are dealing with people around that age.
Right, but if let's bring it to a younger person having these same behavioral traits.
A younger person having it would be a slightly different situation.
Right.
But for most of these people, they have, as he was describing, is higher estrogen levels and not lower estrogen levels. So the difference, the problems will be a little bit different. But they do. Their moods are not necessarily swings as volatile. They don't swing as volatile as the older ones do. But they can have some very deep depressions.
Right.
Yeah.
They can have some very, very deep depression.
Right.
And you have to figure. And then another thing that most people don't realize is sleep problems. There are people who have these hormone problems who can't sleep. And you look in the textbook, there's nothing there. It took years of research, having to look after people who I personally knew, to figure out where is the gap. The moment I figured out where is the gap, and we give them one of 3 medicines, they sleep.
Perfectly.
Oh, they sleep perfectly. Oh, they sleep. Oh, they sleep the sleep of the righteous. They sleep.
Right.
But if you haven't gotten any of those solutions, the biggest problem is sleep. And if you don't sleep, I know somebody who sleeps at midnight and wakes up at 3 a.m. every day.
Midnight, wakes up at 3 a.m.
Every day.
But we are taught that is body clock.
No. The clock is wrong. That clock is faulty.
Okay, Dr. Ayete, let me use myself. I come to work every day. I wake up at 3:30 max. And because I know that the vehicle will pick me up at 4:30. So at 3, I'm awake. And I've done it so much that even when I don't have to wake up at 3, automatically I'm awake.
The trick is when you sleep.
I sleep, no matter the time I sleep, even if I sleep at 7
No,
p.m.
when do you sleep?
12.
Normally 11, 12.
You are waiting for a heart attack. A heart attack is waiting for you down the road.
Right.
Sleep. Your body repairs when you sleep. Your brain goes through a laundry. The water around the brain is washed, cleaned. All the toxins from your thinking activity is washed from the brain. Everybody's brain goes through a washing machine. You alone, you are depriving your brain of washing machine.
Right.
You have to sleep.
You have to sleep. Actually, you're smiling. Did your wife also go through a period where she was not sleeping well?
Yes, she really struggled to sleep all the time. She had severe constipation. She struggled to sleep as well. And these are all things we tackled when looking at solutions on how to solve their problems.
Right.
So doctor is very right.
Right. But Doc, we were being told time and time again that this is normal.
What is normal?
The way we live, how we behave. For instance, a woman is menstruating irregularly or abnormally. Today you menstruate two times in the month, just 2 days. And then the next time it is 4 days in the month. You go, they tell you, oh, it's okay, it's part of being a woman. Some will menstruate 6 months straight and then for another 6 months they don't see their period, and they're told, oh, it's part of being a woman.
It's not. Oyaripa, it is sickness. It's not.
Yes.
We expect you to have a period every month. Sometimes you may get your period at the beginning of 1 month and at the end of the same month.
Yes.
It doesn't mean it's a problem.
Right.
We expect you to have a period within a range of a certain number of days. From the first day of your first period to the first day of the next period, we are looking at between 22 and 34. Once you hit 35 or 21, we start looking at you some way.
Right.
There's something is not right with you. You understand? Once you exceed those limits, we are worried and we are concerned. So, if your periods are coming every 2 weeks, it's not right. Some people have that bleed. So I tell them, oh, this one is not a period, it's an accident. The period will come again in 2 weeks. Then when in 2 weeks the period comes again, they're like, you say, this is not a period. We don't count this one.
Right.
This is a problem. When we correct your problem, this will stop. But you shouldn't be having your period every 2 weeks. You shouldn't be having your periods every 3 months. I know a woman, I met her in the Eastern region years ago. She's got 3 children. And she has a period 4 times in a year. And she managed to have 3 children. I concluded that she's very active. That is the only way she can time those good times in a month. Right. But to her, that is how it has always been for her. But that is not the way it's supposed to be. The problem sometimes with not having your period is that when you do have your period, your body now says, oh, it has been 4 months. I'll bleed all today.
Right.
And then you bleed for 3 weeks continuously because you are clearing the arrears of the work you didn't do. All that is not the way it's supposed to be.
Right.
So if you have those kinds of periods, we have to do something about it.
Right.
And so things have to, we have to correct it. Now the problem with the pill is that it gives you a regular period, but the problem is still there. The problem is still there. So you can use the pill just to, create 1 or 2 action B just for that 1 or 2 months just to align something.
Right.
Or to suppress certain things. But as a long term, it's not a solution.
We'll get into the long-term solution very soon. But once again, you at home, this is the chance for you to send us your messages. Maybe there's someone in your house who has these signs that they show, and we've been told that it's normal, it's regular. You have all the questions. You can ask now. Send it to us, 055-157-5757. Again, 055-157-5757. Now, Doc, I'll come back to you. When it comes to fertility issues, I told you today I have a lot of because in our parts, once again, let's just use our setting because this is where we are. The misconception people have when it comes to hormonal imbalances and even fertility issues. So Ashi has a girlfriend before she became wife. She already was aware of the fact that she was not going to conceive because she had been told time
I do have
again.
Forgive me for interrupting. Pardon the interruption.
Please.
The statements. Under what circumstances was she told that she cannot conceive?
Actually, please.
Because she had PCOS, irregular cycles. She could go many months without a cycle coming up. She had 5 fibroids as well in the womb.
That was all?
That was all. And the doctor said that.
Now, as you have clearly demonstrated, you are able to make her pregnant. Well done. But no, that's not the
But that's what
case.
she had been told at the time. And they were actively looking for solutions for this.
And also, I think we need to also commend Doctor for what he said before this. So he spoke about the pill. You don't have many doctors passing the comments he passed. Many doctors will tell you, oh, take it, it's going to work. They don't tell you about the last part of the doctor's statement, about the long-term effects.
Right.
It changes a lot of things in your body. It actually blocks the natural pathways for the natural progesterone and all of these things to be produced. So let's commend Doctor for that.
Once again, Doctor is here to clear. That's why we brought Doc, because he's here to clear all of that.
And I'm sure many of his colleagues wouldn't like him for saying that.
No, they'll be fine. We'll still go to Doc, don't worry. But I'm only coming from a young woman's perspective. I have a friend who went to the hospital. She has severe cramps. Every single month, immediately her period starts. We know we are not seeing her until it's done. That one even takes 3 days. So one time she came and she was crying. I asked her why she was crying. She said, the doctor says the rate at which I'm flowing and how painful and severe it is, they can't do anything. And that also means I can have a child.
No.
Maybe we need to organize a seminar for doctors.
That she has got painful period. There are several reasons why you could have a painful period. There's something we call a primary dysmenorrhea, which is from the beginning it has always been like that. You really search for it, you can't find an anatomical reason for her having her periods to be like that. But for most people, especially for those that it wasn't that painful before, but has gotten progressively worse over time, there's a progressively worse condition that is making it that way.
Right.
Endometriosis, adenomyosis, those are the two big things. And for quite a number of them, if you address that problem, the pain situation goes away. If you wait until it's quite extensive, for adenomyosis, for instance, it can destroy the entire uterus. So you end up throwing the uterus away because that's the only way you get relieved from pain. The uterus has to go. And I've had patients who have gotten up and said, I'm not dealing with this pain anymore. Take that uterus out.
Right.
Forget this childhood business. I am not dealing with this pain again.
Anymore, yes.
You understand?
Right.
But for quite a number of people, early stages you see it, there are interventions you can put in place to try and shrink it, try and get them pregnant as quickly as possible. And the truth of the matter is that when you are pregnant, no menses. So all those people, they can't work until you deliver. Then you breastfeed for as long as possible. So no menses still, so they can't work.
Yes.
Then after you stop breastfeeding, you get pregnant again. So we are using all that to manage the pain.
But Doc, how did they come to that specific conclusion? Because
that they can't have a child.
Yes, because that is not the only hospital.
No, maybe. Maybe I say maybe this is what I can do for you, but talk to this other person. Maybe they can do more, but not that your situation is impossible. Yeah. You understand? Because your situation may not be impossible. It just means that with the skill sets and the technology that you have available, you can't go any further. Because this woman's case, she had PCOS, which means we can get her to ovulate. She had uterine fibroids, and we can either remove the fibroids by open surgery, remove the fibroid by hysteroscopic surgery by going through the vagina and removing the fibroid. Those are the ones that affect pregnancy. The other ones, they tend not to affect the pregnancy too much.
Yes.
If she's got adenomyosis that you thought was a problem, or even endometriosis, hormones we can give to you that would shut them down for a period of time, and then you work quickly to try and get her pregnant. Worst case scenario, in the case of a woman with PCOS, we know she's got eggs. Even if the uterus is bad, she could use a surrogate to carry the pregnancy. You can't say she won't have a child. You cannot say she won't have a child. So it is not an impossible situation. There are challenges, and some of the solutions are expensive, but they are available.
Right.
And you don't know the person's pocket. You don't know how far they are willing to go. But you'll be surprised when you tell them that this is what the situation is. They're like, okay, we'll be back. Then they come back and say, okay, we are ready to do whatever it is that you said.
Doc, at the end of the day, we all want healing. So obviously, we would find ways and means to get there. But Doc, is it possible for someone to look very healthy but still have hormonal imbalance?
Yes. Like those who have got the breast milk problem that I was talking about. It doesn't show anything on their body. She's gained a little bit of weight, but she's looking around nicely. You get body. You may not actually notice. I actually saw one yesterday. Today. No, yesterday. Skinny girl. She comes in. What's your problem? She's producing some fluid from her breast. What's the color? She says it is clear. I said clear or white? He says white. Let me examine. White. Right. But she was skinny. She doesn't look like she's gained any weight. So you wouldn't realize that, in actual fact, when they say they have weight problems, she didn't have it.
Right.
So you can be looking very normal, and then you would have that problem. There are people who are walking about looking very normal, and their insulin levels are very high. But when you tell them, we've seen something that you notice that I think your insulin levels are high. So I've checked my sugar, it's normal, so I'm normal. And your sugar is normal because your insulin is overcompensating. You are burning at 100 a day when you should be burning at 15. So the result is that when the insulin fails to compensate anymore, your sugar will rise. So you having a normal sugar does not mean you are okay.
Right. I want to go back to the question of the topic of menstruation, because there are also women who are the first 3 days of their menstruation or the menstrual period, they have to change the pads 5 times. So in a day, she's changing her pad 5 times. It could be more. Is that also normal? Because once again, it's something that has been regularized. They'll tell you, oh, I'm bleeding very heavy. I'm a heavy bleeder.
I think it should need to be checked. Because for quite a number of these people, there's a submucous fibroid, which is a fibroid that sits where the baby sits. So like inside here. The fibroid sits here. Or worse, what we call a polyp. Now, an example I can give you of the polyp is like the tongue in your mouth. And the fibroid is like the teeth in your mouth. So the fibroids are, easier to see.
Yes.
But the polyp looks like the tissue. So there have been occasions where I'll do an ultrasound and I can tell the patient that, oh, there's a polyp over here and that is responsible for your problems. And she says ultrasounds have been done severally and they tell her there's nothing there. But yes, there's quality of the machine, skill of the person who is doing it. But it's more difficult to identify a polyp on ultrasound than to identify a uterine fibroid. And for some people, the challenge is just a polyp that is sitting in this space like this. But this is what is causing cramping, it's what is causing bleeding, is what is causing pain. And the best solution, you go inside from below, small camera, instrument, go inside, find the polyp, cut it, take it out. I've done some people who are even awake without anesthesia. It was like, we started, oh, doctor, you continue. Yeah. Before you continue, we finished. Right. Then you go. And you actually, but based on the machine the instrument that you use, there are different types. You can actually remove the polyp. Polyp comes out, end of story. So, and the people who tend to have high estrogen levels from these conditions tend to have more polyps and tend to have bleeding problems. That's when you scan, you can't find a fibroid, yet she's bleeding heavily, but it's because there's a growth inside the cavity. And until the camera is put inside, you are not able to see it. Or there's a special kind of ultrasound that you can do that can identify the fact that, there's a polyp sticking out there that needs to be removed. So there are solutions. But if you have only a saw, then you can cut the wood.
Yes.
But if you have a plane, you have a crowbar, you have drills, you have all kinds of things, there are more things you can do to solve the particular kind of problem. And that is some of the things that happens in our part of the world.
I agree. So in general, just go and get checked. The 5 times changing of pads is
yes, you should get looked at.
Yes. Go and check. It's for your own good.
Anybody who has got abnormal periods, especially the heavy type or the very scanty type, the best thing is put a camera inside and we know what the problem is.
Right. I'll come back to more misconceptions because there's more to ask. Actually, now let's come back to you who was there in person. How did hormonal imbalance affect your relationship?
So issues like low libido, because like Doctor mentioned, estrogen is high. She can't even be wet. This obviously impacted our relationship. There were times where we had to use lubricants just to have sex, and this impacted our relationship a lot. How she easily gets tired, fatigue and tiredness. These were all things that affected us a lot as well. And imagine she not also being able to sleep as well. Right. This will obviously affect us in many ways. And also depression, which is part of hormonal imbalance as well, which we often overlook. And even mood swings. The slightest thing, she may be angry and all of that, which may not be because of her, but because what she's going through and all of that. All of these affected us.
Did you try sending her Momo?
I like Doctor.
Doc.
Momo cures a lot of
in this case, what if Momo doesn't work?
Oh, it works.
Right. But so how tough was it? Now you had already realized that this is what was on ground. Once again, this was before you went to do the research, because I need my men at home to also understand the woman anatomy. You will not specifically know everything, but sometimes I need them to know that when you see these type of things, it may not necessarily, because Doc, I'm sure you've heard people come to you and call you and say, my wife cannot do this, she's just lazy. And so you give them proper diagnosis.
Oh yes. I tell everybody whose wife is pregnant, especially, that your wife is possessed by an alien.
Doc, possessed by who?
An alien that you put inside her.
Right.
Okay.
And that alien is responsible for all her misbehavior for the next 9 months. Every misbehavior that she does is because of the alien, it's not her. And she will not remember that she did it. However, and as a husband, he knows, everything that you did in response to that misbehavior, she will remember for the rest of her life.
That's true.
So, no matter what she does, please be careful in your response.
Right.
And be understanding and accommodating, because these two shall pass.
And that's why the momo is important.
Husbands, please load your wallet. When you realize any slight change in attitude and you remember that the alien is working, just send a little momo. Doc says we'll be fine. I never knew. I just found out. Well, we have messages. So we'll take a few of them because people are very interested in the conversation. This one says, good afternoon. My name is Ifia from Chado. My daughter is 16 years old, but her menses comes every 2 months. And sometimes it comes in brown color. Please, is there a problem?
It's brown color usually means that it is old blood.
Okay.
That means it's blood that came out the blood was produced a few days ago, but it's taken a long time to come out. Right. So that usually means your bleeding is small. Okay. For people who are like very young, we try not to interfere too much because there's something we call an immature axis, where they have not yet developed their system properly. They are still learning how to operate it. So if it's not interfering with their life too much, we try not to interfere significantly. But if it becomes an issue, yes, we will have to intervene. So if she's 16, I think she should report to her doctor, who would usually say, okay, give it a little bit more time. If you realize that it's not getting better, then they would intervene.
Okay. So please monitor for a while and then...
No, she shouldn't. Her doctor should monitor for a while.
Doctor should monitor for a while. Yes. And after that, we can move to that. All right, this one says, hi, please, if you are taking 3 months family planning injection and your period is not flowing at all, can you have a side effect in future?
Can you have a what?
Side effect in future.
No, usually, okay, so there's something that our family planning administration people, the staff, need to let the client know. The injectable works very, very, very well. But once you take it, your fertility does not return immediately after you stop it. Okay. So if we give you the injection now, and you've taken it for like maybe a year, and you don't take it in January, your menses may not come till after June, even though you took the last shot in September, and the effect is supposed to wear off in January. Your menses may not return till June. So if it doesn't return, it's not a problem. But when it returns fully. You understand? So the injectable it must be managed a little bit differently. If you know you want to get pregnant in March, don't stop in January, because by March it is still working. You understand? Right. You stop in maybe your last shot is maybe in September is when you don't take again, knowing that if you get pregnant in October, you won't get upset too, but your target is March. You need to give it a little bit more time. So, but once the effect leaves your system, it leaves, but it lasts longer than the 3 months that you expect. Right. But it's sometimes a good method even for people who have got heavy periods to say, you're trying to stop their periods for a while. Okay. Well, this one says, hello, Lois, you're looking good as always. Thank you. So my fiancée had her period twice in 1 month. I mean, she had one the first week of the month, and she had another period the last week of the same month, and it happens for 4 months. So please, is that a problem? It cannot happen for 4 months. The reason being that if you have it on the 2nd, and you have it on the 28th, it's normal. But that being the case, next month you'll not have it on the 2nd. You understand? Yeah. You may have it on the 25th. So it cannot happen continuously for 4 months. Right. But it can happen this month and still be normal. But if you have it on the 2nd, and you have it on the 15th, and you have it on the 28th, that's a problem. Right. That is not normal. So in essence, please go and see your doctor. This one also says, my younger sister, who is 21 years, sees her period 2 times in a month. Each period lasts for 5 days. She bleeds severely and has severe cramps. Could this suggest any hormonal issues? We don't know the interval. Once again, that's always the problem when it comes to this thing. What is the interval between the first bleed and the second bleed? If it's a very, very short interval, we say it is not normal. If it's what we expect to be a normal interval, and I've just shown you how even with a 28-day cycle, you can have your menses twice in 1 month, at the beginning and at the end. So if the interval is close, it's a problem. If the interval is, far, it's not a problem. The other thing is that she bleeds very heavily. You shouldn't be bleeding very heavily. So it needs to be looked at.
So, Doc, if I have my menstruations, have it twice a month, but then the interval is every 4 months. So,
every 4?
For instance, the 2 times a month happens once every 4 months. Do you understand what I'm trying to say? So in March, I menstruated twice in the month. It doesn't happen again. It goes back to regular, the one time, and then the next time it happens is 4 months again. Is that normal?
What is the gap between the 2 times in 1 month?
Let's say it's the 28th.
28th, then it's normal.
Okay.
Because the way the calendar goes, you see, the whole year, if they had just made it 28 days in a month, it would have been easy. Somebody decided to make it 31, 30, 20, all this confusion.
Right.
Because if you divide the whole year by 28, it's so pepe. But because we did this thing, so what happens now is that for some months, your cycle will start at the beginning of the month and come again at the end of the month, just because of the nature of the month. If you have your menses if you have a 28-day cycle, and you have your menses on the 15th in February, in March it will come 15th. But in April, it won't come 15th. You understand? It will come on the 12th. And in May, it will come on the 10th. Then somebody tells you, my period, it doesn't stick to the same day. It will only stick to the same day if it's a 28th month, or a 26th day. Because some people have got a 26-day cycle. Some people have a 25-day cycle. They are all normal.
Yeah.
24-day, they are still normal. So all depends on the interval between the two dates. If it's less than 20, it's 21 and less, we are concerned.
Okay. Well, this one says, I'm a young lady of 26 years and I lactate sometimes, although I have never given birth before. I have experienced high prolactin levels for 6 years now. Dostinex was prescribed for me, and after taking it consistently, it reduced, yes, but still lactating. What should I do?
Her level has obviously not gotten to it hasn't gone down enough to the point where it would stop. She needs to continue taking the medication that she's been given. And even after it stops, they need to adjust the medication to maintain the stop. Because you have a dose that brings it down, then we need to maintain it down there. If you stop the medication, it rises again.
Right. This one says, please, I would like to ask if prostaglandin, am I saying that right? All right.
Prostaglandin.
Yes. Suppressing drugs are good for treating menstrual cramps and also for women who ovulate during menstruation. Are there any long-term remedies?
This ovulation during menstruation, I always have a bit of an issue with that description. If you have a 21-day cycle and your second half of your cycle is 14 days, that means you ovulate on day 7. You would only ovulate during your menstruation if your menses last longer than 7 days. You understand? If your cycle is shorter than 21 days, I doubt you're ovulating.
Right.
So that whole ovulation during menstruation, it requires a bit more, investigation to be sure that this person truly ovulates during her menstruation.
I think it's also it's the way we feel. Sometimes you hear a lot of women say that when I'm menstruating is when I feel the most active. The need to want to get closer to my partner, to have intercourse.
Some people are like that. Some people are the opposite. They don't feel like, don't touch me.
Right.
We are all different. Our noses are not the same.
Yes.
So the way we feel are not going to be the same. We are different.
But it's normal though, right?
What is normal?
To feel the urge.
Some people, it's a very normal thing for some people.
Right.
It's like, that's how they are created. There's a special feeling that comes at the end of the thing when they decide to do the thing.
All right, this one
Afternoon, I can't use certain words.
This one says, big ups to doctor for speaking the truth about the C-pills. If only our doctors will be ready to learn new treatment guidelines with regards to PCOS, it will be of great benefit to us women. Doctor is speaking my mind right now. We need more of this education. Thank you, Archie, for the good work. God bless you guys. And I think we need to give both of them. Now, Archie, I know that in your research, you did hear so many people say that certain foods affect the hormonal imbalance. For you, did you realize that probably if she takes food A, she behaves a certain type of way? Did you see?
Yes, we observed all of that.
Right.
For instance, why would a chicken be growing in 5 weeks? Something is wrong somewhere. So from our research, we also realized if chicken are giving growth stimulants, they are growing bigger, faster. What is the effect of that growth stimulant in the chicken as you eat the chicken? again, estrogen is high, causing problems. If that comes into your body, it's still going to increase the estrogen, which is causing the problem. Apart from that, we also realize meat products, let's say cattle and other products, these animals are also giving growth stimulants as well. And it comes back into your body again, causes your estrogen levels to go high. For instance, even chemicals in creams and other, it's recently been discovered women hair goes to a lot of processes with chemicals being applied onto it and all of that. These are all chemicals coming into your body. Chemicals coming into your body will push the estrogen level high again. There are clothes women wear. We discovered in our research nylon, polyester from plastics. As a woman puts them on, you are sweating, it goes into your body. All of this has effects on your body. So basically, she stayed away from chemicals. We made sure whatever we're eating was organic and non-GMO, has no preservatives on all of these things, and that also helped us.
Like, did you, before you found the solution to that, were there certain foods that she was eating that you saw that probably was affecting her one way or the other?
We can't really say a certain food. So we cut out everything that was non-organic, because if it's non-organic, it's coming into your body, it's going to affect the body. And for instance, doctor will tell you fibroids like environments which are inflammatory or support inflammation. If you're eating foods that support inflammation and it goes into your body, it's going to contribute to the fibroid coming or the fibroids becoming big. These are all things we looked at, and we made sure she wasn't getting close to anything like that. Also, doctor spoke about insulin. At some point, we had to cut off certain carbohydrate food to make sure we're not putting pressure on that same insulin to get the tummy to be bloated and all of that. So these are things we did. That really helped us.
Right. Doc, what are we supposed to stay away from? Because somebody is frying chibum at 11 a.m. or 11 p.m.
11 a.m. chibum.
And
Chibum is egg and
bread.
Yeah, and then there's cheese. Some people add cheese.
Oh, cheese is fine. Cheese is fine.
Okay, but if we're doing that at 12 a.m.
At 12 a.m. Eggs with onions and tomatoes and cheese.
Big bread.
Is that something
The bread is the
I
problem.
never do that.
The bread is the problem, but the eggs there, they are fine.
Right. But what are certain things that we
Essentially,
stay away
if you are insulin resistant, I said it all depends on your type. But if you are insulin resistant, that means you need a lot of insulin to bring your sugars under control. In addition to the medication that we give you, one of the most important things you can do for yourself is to cut out carbohydrates. And cut out easy carbohydrates. And in our environment, the easy carbohydrates, bread. All of you are guilty. Rice.
Yeah.
Soft drinks. Juices. There's fruit juice, fruit juice, yeah.
Fruit juice.
And I'm happy doctor mentioned juice, because
Fruit juices.
look, some people think if they are drinking orange juice, it's better than the Coca-Cola they are taking.
Oh.
I mean, because
But they always-
There's
our
ad-
small research
There's
showed
added
us
sugar
that.
in that one too.
Is it?
So it comes back to the
So-
same level.
Those and then flour, generally, flour products, those are like the big criminals, because here's the challenge. When you take it, it goes straight into your bloodstream. And because it's in either a liquid form or a high concentrated sugar form, there's no blocking it in raise the sugar level, raise insulin levels.
Right.
We need to eat in a manner that your body will struggle to extract the sugar out. So let's take corn. If you drink cocoa, your sugar will spike, your insulin will spike. If you eat banku, it will spike less. If you eat gan kenke, the spike is a little. If you eat fanti kenke, no spike. And it's because of how each of them is made. Cocoa, liquid corn, you drink it into the tummy, straight absorption, sugar rises. Banku is a bit firmer. Your body has to do a little bit more work to break it down. It will still raise it. Gan kenke, you know, gan kenke has roughage and things. You don't peel the. So the white gan kenke, not that one. That one is raise your sugar. But the one that has got the fiber on it,
Yes.
the husk on it.
Yes.
That one, when you take it, your body has to take its time to remove the fiber before it can get to the sugar. So the sugar spike is lower. Fanti kenke is fermented on top. The fermentation also reduces. You understand?
Yes.
So that is just the way. So the same thing is corn, but the different versions of it. And cornflakes is like bad crap.
Right.
So we just need to find the same thing, but better ways to eat it. I try and encourage my clients that eat more salad. And especially eat a salad before you eat.
Okay, so that's a starter.
So you're coming to eat fufu, you must have a starter of salad, then eat your fufu. I know it sounds odd, but you will live long. You understand?
Right.
You will live long.
Doc, please define the salad, because somebody is seeing salad
Yes,
as
go
the
ahead.
one that has the...
Mayonnaise.
What? Oh, no, go ahead.
I feel like you're looking at me with accusing eyes.
No. I'm very innocent in this spot.
So someone is eating the salad,
Yes,
the regular
what's-
Ghanaian salad.
everybody
that has
asks this question, so go ahead.
The corned beef.
Corned beef. Corned beef is not the best, but it spice. Go on.
Okay, the mayonnaise.
Mayonnaise is mainly fat, not a problem.
Okay,
Fat makes you full. Oh.
okay,
It doesn't make you fat. It makes
Right.
you full.
okay,
Sugar makes you fat.
okay.
Okay.
Ketchup.
Sugar.
So no ketchup.
if you can avoid
Some people
ketchup.
even drizzle milk on it.
Milk on salad.
I'm telling you.
Yuck.
Are you sure that's not what you do?
The sardines.
Sardine. Load more. Sardine is good for
More
you. You get
sardine.
omega-3 and things. So you add to your sardine.
Okay.
What else?
So
What else? You haven't finished.
there's baked beans.
Baked beans, unless you can find a baked beans that has got very, very low sugar, but they tend to be a bit sweet. Ketchup is worse than baked beans,
Right.
but baked beans is like a milder ketchup.
Right.
I would rather, if you can avoid that one, yes. But salad cream, go ahead.
So salad cream is
Yeah.
okay.
Oh, load it.
Mayonnaise is fine.
Yes.
Corned beef is fine.
Corned beef is not the best, but it's how much corned beef will you put on it? It's okay. Add small.
I don't know.
Guilty pleasure, small corned beef.
Right.
You didn't
The
mention eggs.
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 X is good.
Eggs. You can chop meat, boy, and put it inside.
Chicken. People fry chicken.
Chicken. Hey, chicken. A chicken Caesar salad. Lovely.
Right. But it's fried though.
Eh?
Fried.
Oh, Charlie, there's some fried one be that in America. The way it's sweet.
Oh, dog.
Whenever you go there, and there's some particular one salad be.
People are clapping.
Fried
Come
chicken.
anymore.
But how you see what is wrong with fried chicken?
The oil.
Which oil?
Which oil? Yeah.
The oil. Palm oil, no problem. Agringo, no problem. Coconut oil, no problem. Even fried okra because it's palm oil.
Right.
You're bad. But the other ones is engine oil.
Right.
Seed oils.
Yeah, those ones they are engine oil. Today we're talking about they're engine oil.
Yeah.
Right. So we can eat. It's just
Yes.
that it's so the salad. Let me also draw a picture for you, because as you said, if someone is listening and is very happy and is going to buy a big bowl of salad.
Eat your salad.
How big do we have to control the portion size?
Salad.
Yes.
You can eat one bucket if you to go.
This should tell you the type of audience I have. So you can eat your salad before you eat your fufu.
Yes.
And then this time is the fufu that would have to be in portion
So
size.
if you have a good portion of a salad before you eat your fufu,
Yes.
you cannot eat a lot of the fufu itself.
Yes.
You understand? And the trick, actually, and this is not how we eat, but this is how we should eat. Eat your salad. You didn't add avocado to the salad. Avocado is... So after you've had your salad, then eat your meat. Then when you finish, eat the fufu.
That wouldn't lead to a spike.
Right. So salad, meat, fufu. In this case, do we still have meat in our soup?
The meat is in the soup. You eat the soup. So when you start the fufu now, you eat the meat.
Oh, so the meat shouldn't be the last thing you eat.
No. The meat comes earlier.
So, Doc, let me ask this question, because someone is also at home asking, how about I get my salad? Before I eat my fufu, I take one tot.
Why?
I mean, it will help the fufu go down properly.
It's called empty calories. You would grow fat. It doesn't. It's of no benefit. It doesn't give you appetite, fool.
Right.
It doesn't do anything beneficial to you. No, eat your food. First of all, why are you taking an appetizer when you know you eat too much already? That is why we are trying to reduce what you eat. You're already eating too much. So what's the point? You want to gain more weight?
Right.
No.
Please stay away from that. But now let's come to supplements. And I'll come to you, Ash,
Yes.
because you have stellar supplements for us. But Doc, if we introduce supplements into the conversation, is that a good thing?
There are some very, very good supplements. Very, very good ones. but it has to be the right one. There's a lot of the supplements there are good supplements available, and some of them tackle the exact problem, and so we would recommend them. Some too are useless.
What do these supplements tackle? What effects do they have on someone who has this imbalance, the hormonal imbalance?
Name the hormonal imbalance, and we'll see what we can. Let's talk about PCOS.
Yes.
So for PCOS, some people lack a particular enzyme. The enzyme prevents them from converting item A to item B. Item B opens a door in the liver that allows sugar to leave your blood. Without item B, you can't open that door. So the sugar accumulates and the insulin goes up. There's a supplement that you can give you, which is item B. It's not a drug. Right. It's your body should produce item B. It's not produce item B. We've given you the item B. It goes and opens the door to the liver. The sugar goes out. Problem solved.
Right.
So there are things like that. There are medications that we can give that will help bring the insulin levels down. There are supplements that we can give that will bring the inflammation that is causing all this down. And when that happens, the rest of the other things fall into place.
Right.
So it all depends on what you are trying to achieve. And then if you know where the gap is, you fill the gap. The use of supplements is specifically in your body, you are not producing certain things right because of a genetic problem you may have or you inherited from your parents. Whatever you're not producing, if they give it to you, your body works properly.
Right. So just find the right one to take.
Yes, so you have to, usually best if prescribed. The doctor says, get this one.
Right. Now that brings me to Archie, because you, after your research, after years of looking into this and trying to make sure that your wife is okay, even when you don't send her mumu, she's intact and she's living her life peacefully, because also you saw the amount of pain she was going through, decided to come out with Stellar supplement. Tell us how that happened. What went into the creation of the supplement?
All we did was we focused on what was wrong with her. So inflammation, the bloating issue, like doctor spoke about, insulin, she not being able to sleep, or the constipation issues, her cycle not coming up every month. And we focused on these issues and solved those problems. So we tried over 30 different nutrients, but we realized 11 of them was what helped her. So 11 here is magnesium, folic acid, vitamin B6, zinc, flaxseed, inositol, maca root, sage leaf, green tea, a probiotic and a prebiotic, all 11 in one capsule to be taken twice a day. And we're buying it individually from the pharmacy. So we could buy and she'll be taking it one by one. And we realized her acne was leaving. The hair that used to come on the chin was no longer coming. The last time my wife did waxing was probably about a year or two ago. Meanwhile, she used to do it twice a week. There's no excess hair on the chest again. Her cycle is more regular. She sleeps better now. There's no constipation. She does it. She goes to the toilet twice a day at least. And we said, let's try for a second baby. At this point, the product was not out yet, but we knew what she was taking. And we tried for a second baby. And that was the smoothest thing ever. There was no ambulance call. It was so quick. Even though I didn't send Momo. It was so quick.
Right.
And this baby traveled to full term.
Right.
And he is 1 year. And I remember when we were having the first one in the theater, the doctors warned us not to have a second one.
Right.
But like doctor said, nothing is impossible. If you always find a solution, it will be possible. And that's what worked for us. So we launched last year in the UK, and it's doing so well.
Right.
It's been approved in the UK. It's approved in Ghana by FDA as well. Hopefully we get to launch in Ghana soon.
Hopefully. We can't wait, because I cannot tell you.
But we have close to about 2,000 customers in Ghana.
Oh.
Yes, and I'm happy doctor is here and talking about these issues, because I was looking at the data before coming in here, and we realized about 60% of the women have PCOS. These are women who have gone to the hospital, told by doctors they have PCOS. They've been put on contraceptive pills and all kinds of things. And for many months now, they're not seeing any improvements. And they are being told, just continue taking it. And there are even women who will tell you they have fibroids, and they are told to just go and give birth. As if giving birth is like buying tomatoes on the market. And they don't even have husbands, they don't even have boyfriends and all of that. So yes, we are happy to continue the education. If people come and we don't understand, we refer them to their doctors. We are not medical people. I'm not a medical person, but we have gynaes on the team as well. We have nurses on the team. And hopefully we get to educate women and solve some of these issues for women.
Right. Now, Doc, supplements, I'll come back to you, but supplements, is it something that you have to take for like a lifetime? And if you stop, does everything come back? Is it reversed?
If you stop putting fuel in your car, what will happen?
I like
Not
dog.
move.
So if the problem is a gap that is being filled, and you now operate normally, and you stop taking it, the gap will come back again. So that's just the way it works. If your body can produce it, we wouldn't be in this problem. If your body is not producing it and it's being given to you and you are functioning normally, good.
Right.
But if you stop taking it, it's like the people who I said I give them the medication for the sleep. If they take it, they sleep. And they sleep well. They wake up in the morning, no hangover, no nothing. Get up, go to work. But if they don't take it, you understand? Then after a while, the sleep gets disturbed.
Right.
Some are even sleeping in the afternoon now. One of them, she delights in afternoon sleep. The 12 midnight woman.
Right.
Oh, she can decide, oh, this afternoon I'm going to sleep. Then she'll go and take her medicine, she'll sleep.
Fast. I see. Now, actually, you obviously found the solution, and even before this product was, you had already conceived, and then your child came out, and then you decided to bless the world with this. What testaments have you heard so far?
So many. We have customers who have not seen their period in over a year. They come on our product, 1, 2, 3 months, they are seeing their period or cycle. There are those who had fibroids. And also, by the way, our product doesn't treat fibroid. So you are helping your body to not create the environment for the fibroid to thrive.
Right.
If a doctor tells you go and do a surgery, you have to go do the surgery. Our product is not coming into your body to come and take out the fibroid. It's only supplementing the food you're already eating. So like doctor said, you are helping your own body to heal itself. A lot of them go do tests. They are not seeing their fibroid grow like it used to grow. The fibroid pains they used to have are not coming anymore. The heavy periods are not showing up anymore. So yes, we are happy. Close to 2,000 customers, and there's not a single person who has used our product and not seen a major improvement in their life.
And that's Archie's youthful wife on the screen. Today, she's a mother of 2, and it's because one resilient man said, I will not give up on you. I will send you Momo, and I'll still love you. Please put your hands together for Archie.
Thank you.
Now, let me come to my studio audience. You have been listening, and anytime Doc said something, you were clapping. So obviously, I know you have questions for Doc. So anyone who has the microphone and wants to ask a question is free to do so. Do we have a lady in there? All right, so please stand. Yes.
Okay, thank you for the opportunity. Yeah, I wanted to ask, there is something like hormone replacement therapy. It's mostly used by transgenders, and I want to ask the benefits and the risk concerning that therapy.
It's not mostly used by transgender.
Yeah.
It's actually used by women who have reached the age of menopause to replace the hormones that their body is no longer producing. So if you are in that age, you are in the menopausal age, and you are not able to function properly, like at work, you are having mood swings, you are having your cloudy brain, things of that sort, then we give you the hormone replacement therapy. Hormone replacement therapy is used in IVF. If somebody is trying to have a frozen embryo transfer, for example, we give it to you to replace the hormones that we have shut down by the injection that we gave you earlier on, so that your lining will grow the way it is. That is what hormone replacement therapy essentially is in this context. The transgender people, they are trying to change their sex. So they are a more recent addition to this thing. But it comes with its own challenges. There are some things, if your body is not designed for something and you give it that thing, it comes with its own challenges. But for them, they think it is worth it. And that is why they are doing it.
Right. Okay, so do we have any more questions?
I wanted to know if men can have hormonal imbalance. And then
I have a belief that men have PCOS. Yes, they don't have the P for us to be able to. For us to be able to.
How does DS manifest?
You don't see, except when you check their insulin is high.
Oh.
Hair, the men have hair. So the more hair, maybe they are growing bald. They say if you see a bald man, we start wondering whether. But because they don't have ovaries and they don't menstruate, we don't see that part. But when you check their insulin, high.
Right.
But the manifestations that you see in the woman are normal things in men. If they become more hirsute, it's normal. If you don't notice that one. They don't have ovaries for us to scan them and see that their ovary has got polycystic formations.
Yes.
But if you check their insulin, like you check in other people, you would see the same level of insulin resistance. And men have come with very high insulin. We test for insulin. So if you come, we suspect, we test your insulin. If it's high, we manage it. So you come insulin, and there are men that we check, and their insulin levels are high. The problem with a high insulin level is that you will continue insulting your body, and the insulin will remain high, and you will never know until your insulin runs out.
Right.
And then you are diabetic. And by then it's too late.
Right. Well, we have quite a number of messages. We'll take them. This one says, good afternoon, please. My name is Watima from Labadi. Please, I am 47 years old and my menses stopped coming at age 38, but I have 4 children. I don't have any pain, just that I sweat a lot. Am I okay?
I think your retirement age came early. Yes, it sounds like a case of an early menopause.
Right.
Yes, well, they're sweating a lot. Menopausal people tend to have sweating episodes, cold, clammy sweat, things of that sort. Yes, so it is more likely that she had an early menopause. But here's what is interesting. Yeah. She became menopausal at 38.
Yes.
She has 4 children.
Yeah.
So if she had delayed childbirth until she was 39, like by now she has 0.
Right.
Yeah.
So you must have your children early, okay?
Dog, don't let my mother call me. My mom will call me.
Your mother should call me.
Don't let her call me. You have a question. Hold on, I'll come back to you. But doctor, I'll ask. My mom, somewhere last week, she said she was in the shop, and all of a sudden she felt very hot. Is that also part of it? It's hot. It feels like she's about falling sick. A little bit of feverishness.
Yes, that's why they can be driving in town. When they enter the house, then they take off all their clothes.
That's
will go this way, clothes will go that way. That is why.
Right. So, mommy, it's menopause. This one says, I am packed from home, and I must say, Stella supplement is a game changer for me. I'm on my 2nd bottle, but have seen tremendous changes. I can't wait for it to be launched in Ghana. Please put your hands together for Stella. This one says, please help me find out from doctor, how do I confirm whether I truly have hormonal imbalance? From Elekem Evans Brown from Insawum. So a man wants to know how he can tell. Yes.
Oh, no, he can just run a hormonal assay.
Right.
We've got what you call normal levels. And there's a range that your number must be between. So whatever hormone you think you are concerned about, you can run the test. In this country, you can actually walk to a lab and make a request yourself. Otherwise, see a doctor and discuss which is the better method, discuss what you want to investigate, and then you'll be able to draw the samples, do the test, and then we'll know what your situation is. Yes.
Yeah, sure. Please, one question, one more. Let's go.
So you did say something about the athletes, they having to perform excessive exercise and stuff like that, resulting to them not having their periods and other stuff not coming early. So my question is about fibroids. So if to combat these diseases, could we let these ladies or women do like excessive exercises just to, bring them down and break them to, save them or something like that?
It's an interesting angle, but I think it would work. It's a crazy idea, but it would work.
To get your wife to go to the gym every
No, so if she performs excessive amount of exercise to the extent that her period stop, essentially her estrogen levels will not be rising. And therefore, the fibroids don't get the estrogen and environment that allows them to grow.
All right. Well,
it's a very Frankenstein idea, but it's a good one.
You people, make sure you sort it out before you take her to do the exercises. But finally, Achi and Doc, I have to let you go. For Achi, there are so many people who are very interested in the supplements now. So where can we get it? When is the launch finally going to be happening in Ghana? And just really contacts we can reach out to on social media, please.
I mean, anyone who is interested can reach out to us on social media. We're on Instagram, we're on TikTok, we're on Snapchat. Just drop us a message. We'll definitely reach out to you. We'll call you. We speak to every single person. We don't just sell a product. We have a very customer experience policy where we speak to every single person. If it's something we can't handle, we direct you to your doctor, go do the labs, come back to us. If it's something we can even tell you to go show it to your doctor. Let them read the ingredients and the composition. And if you come to us, we'll sell to you. So we are active on social media, Instagram, TikTok, Snapchat.
What's the name on social media? Stella
Supplement. And our website is www.stellasupplements.com.
All right. Is there a Ghana contact we can reach out to?
No, you come to social media.
All right.
Like I said, we don't want to sell. It's not about the money, it's about making the impact.
Right. So reach them on social media and be fine. Doc, finally, final words before we go.
I'll say Doc's home for him.
You say?
Send them over money.
No.
If you know you've been told that you have a hormonal imbalance, you are not alone. It's one of the most common things, conditions around. However, there are solutions, and the most important thing is find care, the right care at the right place. You would get a solution to your problem. You don't have to be miserable. You don't have to be depressed. You don't have to be thinking your life is not worth living just because you have this condition. No, you are not alone, and there's hope, and there are solutions.
Right.
And you'll be fine.
And you'll be fine. Please put your hands together for Doc. This has been a very, very interesting conversation. We've learned so much, and I hope you at home has also paid very keen attention to it. Also, once again, if you have hormonal imbalance, just like Doc said, you are not alone. Just go and find good health for yourself. Well, thank you so much for joining me in studio. Doc, you'll be back because there's so much more I still have to ask you. We have to just more. So, yes.
I think we also need to commend Doc, because you don't find many doctors who are very open-minded like this. Many of them push many of these women into these situations and get them very depressed. Even the way they speak to them, dismiss them. But Doc has been very open-minded in this conversation, so we need to commend him.